Really interesting happened today, and I just wanted to tell everyone about it. So, I had a doctor's appointment earlier today. It's actually a specialist, and I need to get a treatment from them. It's nothing major, but I need to get a treatment at this particular place. And the treatment is not comfortable, and I had been going to different specialists trying to find one that would be finding some type of way to help accommodate the sensitivity and the severe pain that I was feeling from undergoing these treatments. And pretty much every specialist that I went to or doctor's office would say it shouldn't be that bad. And yeah, it's not the best. You just have to grin and bear it, etc. And I kept saying there has to be some way to make this less painful. I have to be honest, I did this treatment a couple of times without any sort of support and any type of accommodation, and it was incredibly painful. I had to stop them each time, and I didn't finish it. And I know that it's just not something that I'm able to get through. Very uncomfortable for me. After I learned some information from being at the ADHD summit a few months ago, I realized and better understood that there is a connection between chronic pain and a sensitivity, our sensitivity to just feeling things in our clothes, on our skin, and chronic pain as well. I knew that this was going to be a challenge to be able to have this treatment where it wasn't as painful for me and maybe I could feel it the same way the average person does. Luckily, I found a specialist that also has ADHD. And I didn't know it at first. I signed up, I went to her office, we had our consultation. I told her what I had been going through and what I was seeking. And she said, "You know what? We can help you with this. It's unorthodox and it's not necessarily conventional, but we can do these 2 or 3 additional steps to help you get through this." And it was such a relief when I went to the first appointment, getting that treatment. It was just miles away from where it was before. And it was because I had a doctor who is neurodivergent, who has also experienced people being not flexible and unwilling to accommodate someone with our needs. And she and I had a conversation earlier today about why she was willing to take me. And she mentioned that several of her staff was saying that she should just turn me away. It's extra steps, it's unnecessary. Why can't I just deal with it and figure it out? It's not a big deal. And she said that's the very same thing that people have been saying to her entire life. She refuses to dismiss any potential patient or potential client because their case needs extra steps or they have additional sensitivities. She knows how it feels to be turned away, and she also knows how it feels to have these issues. So it's so important that neurodivergent people are well reflected in the healthcare industry. And if you have medical professionals who are treating you and they maybe aren't neurodivergent, that's okay as long as they understand it, they have studied it, and they have learned what our needs are and what the flexibilities that should be afforded to us are. I'm really grateful that I found her, and I will keep going and I won't turn back.